So this picture illustrates how our body compensates for respiratory acid-base balances primarily through the action of the kidney. On the left side, we see a diagram showing the kidney's role in depict the kidney regulating bicarbonate level in the blood and urine to maintain balance. The key takeaway here is that the kidney response is slow, taking anywhere from hours to days to fully kick in. So now let's look into the specific mechanism. First, in the case of the respiratory acidosis, meaning too much acid in the blood. Due to the respiratory issue, the kidney respond in two ways. The first then increases the excretion of the hydrogen ion in the urine. This helps removing acid from the body. Second is they increase the reabsorption of the bicarbonate back into the blood. Bicarbonate is a base, so bringing more of the bicarbonate back into the blood helps to neutralize the excess acid. Second, in case of the respiratory alkalosis, which means too little acid in the blood, also due to the respiratory issue, the kidney adjusts differently. First, they decreases the excretion of the hydrogen ion, meaning they hold on to more acid. Second, they decrease the reabsorption of the bicarbonate, allowing more of the base to be excreted, which help to increase the acid level toward the normal. So talking about clinical overview, managing acid-base imbalances. When tackling acid-base problem, our first and most critical step is always to identify and treat the underlying cause. Think of like this: if your boat is sinking, you just don't throw the water, you patch the hole. For example, if severe sepsis is causing lactic acidosis, antibiotic and fluid resuscitation are key, not just giving bicarbonate. So manage conditions known to cause these imbalances. They include diabetic ketoacidosis, where we'll give insulin and fluid, in kidney disease, which might require dietary changes or even dialysis, and conditions like severe vomiting or diarrhea, which causes alkalosis or acidosis respectively. Almost always we'll need fluid and electrolyte replacement and careful monitoring. Dehydration and imbalanced electrolyte like potassium are common and can be dangerous, so we are constantly checking blood levels. Finally, for moderate to severe metabolic acidosis, we might consider sodium bicarbonate IV infusion. But remember, this is a caution approach, usually reserved for the severe cases, as it treats the symptom, not the root cause, and comes with its own set of potential side effects. The goal is always to restore balance by addressing the source of problem.